Hey guys, today we're going to move into the next section. So we are done looking at Punnett squares and pedigree charts for now, and we're going to talk about developmental genetics. So this deals more with stem cells, which you've probably heard of as a rather controversial topic, and it is it's very political as well. We're going to try to steer clear of that. Just keep an open mind as we go through this. And the goal is for you to learn about different types of stem cells and what they can do for us to help us. It's not necessarily to form an opinion about whether or not you think it's good to use them or not good to use them. It's strictly just information so you know what they are and how they can be beneficial. So development would be something that you learned about back in biology. It's one of those characteristics of life. We say growth and development. And it's a series of changes in a state of a cell, tissue, organ, or organism. And it's basically growing from a little tiny baby into an adult and then into a senior citizen, hopefully. So here you can see the changes that a woman would go through. She starts out as a little baby who's helpless, goes into a toddler, a child, a teenager, an adult, maybe a young adult here. Now she is an adult. She has a baby. She's getting a little bit older, and now she is a senior. I also think it's kind of funny. If you look at the shoes that she's wearing, I don't know why they felt the need to put her in stilettos holding up a baby, but nobody would ever do that because babies are very difficult to hold in heels. I know from experience, and I don't wear them anymore. So here are the stages of development for a baby, and this is whenever they are still forming inside of the mother's uterus. They start off as a fertilized egg, and day one after that egg gets fertilized, it's starting to divide. And it keeps on dividing, making its way into the uterus. When it becomes a blastocyte, that's whenever it hits the uterus. So those first couple days there, it's just kind of chilling, floating around in there. And then implantation occurs, and it starts to get this little yolk sac here. So the yolk sac is what's going to feed that baby until that placenta can really take a hold of it. And that placenta doesn't really mature until about 16 weeks. So they still use those yolk sacs for quite some time. And they kind of look like little aliens here. They have tails. Yeah, you had a tail at one point, and it then disappeared because we don't have tails anymore. And right around 6 months, that's whenever you can really start to see that it's looking like a baby as we think babies look like. I'm not trying to talk about when, babies are technically considered babies with heartbeats and all that, just based off of physical features when it looks like a baby. So developmental genetics, you're going to be understanding how gene expression controls the process of development. Couple themes we're going to talk about. It's a zygote, that's a sperm and egg come together, and this is where development starts. You're considered an embryo 2 weeks after the sperm and egg unite. The cells are going to divide and arrange themselves into units to become determined. And when we say determined, that means that they are going to be very specific as to what they will become later on. Are they going to become a muscle? Are they going to become your intestines? Are they going to be part of your bones? They already know what they're going to be. It's like they already went through school, they hit college, they determined their major, and that's what they were going to become. Cell differentiation is where cells' morphology, so what they look like, and the function have changed permanently to become highly specialized. So these cells, they know exactly what they're going to do, and they know how to go about doing it. The pattern of formation is the coordination of the arrangement of cells and their differentiation that leads to the formation of an adult body. And this is going to occur in both plants and animals. Animals, we are organized along 3 axes. And these axes, if you've taken anatomy, you probably talked about them. Even in zoology, they touch on them a little bit. The dorsoventral axis, the anterior-posterior axis, and the right-left axis. Many bodies are segmented into specific body parts, such as wing or legs. And when you're talking about humans, these axes get a little bit jumbled, so I'm not going to do human examples here. We're just going to look at a couple examples of organisms, animals or insects. So here we have a fly, and if we're looking at the dorsoventral axis, that would be cutting it straight down between the eyes all the way through to the butt. Anterior posterior is essentially cutting off the legs and separating the legs from the upper half of the body. And the right-left axis is going to be cutting the head down the middle away from the butt of the fly. It's really difficult to determine these particular axes with humans because we are bipedal, meaning that we walk on 2 feet. And so we don't have, that where our hands are on the ground, it's not as easier to cut us anterior, posterior. It means a little bit of something different, and some of these axes kind of run into each other. I don't want to confuse you with that, which is why I don't do human examples in here. So here's a fish, cutting it basically in the same way. Dorsal ventral would be, again, cutting it between the eyes and kind of filleting it right down the middle. Anterior posterior would be cutting right through its mouth, and you're going to be separating the upper side from the lower half of the fish. And right to left axis here, they're going to be cutting it right through that dorsal fin, separating the head from the butt. Plants, they have a root shoot axis in a radial pattern, and it's determined at the first division of the fertilized egg, and growth is going to occur in a radial pattern. So here is what it would look like in a plant. They're basically being cut right down the middle in half. Pattern formation depends on the positional information. For an organism to develop the correct morphological features, each cell must become the appropriate cell type based on its position relative to other cells. So what that's saying is that a cell can't just become whatever it wants to be. If it really wants to be a muscle cell, but it's already located next to too many muscle cells, it might have to be a nerve cell instead. Cells respond to positional information in one of 4 possible ways. This is through cell division, cell migration, so cells can move around, cell differentiation, where they're talking to one another and determining how many cells there are of a certain type, and apoptosis, which is cell death. So these red dots here are showing cells that are undergoing apoptosis. So this is going to be a mouse's paw, and right now you can see that it's kind of webbed like what a duck would be. But you can see these darker lines in here, and those are going to be the little bones for the individual fingers. And you guys actually go through apoptosis as well. So cell death is going to occur in between these 2 bones, and that's going to force your fingers to pop out. Apoptosis is going to occur everywhere where these little asterisks are. So incomplete differentiation due to a lack of apoptosis is what's going to lead you to have webs, or where your fingers are still connected or your toes are still connected. And they can fix that. Normally they'll do it when you're younger, just cut them in half, and then you have 2 fingers or 2 toes, because the bones are still formed in there, but those cells didn't get the right cues that they should die. So it is important actually that your cells do go through apoptosis. Generally, you're always thinking, oh my gosh, I don't want my cells to die. I need all my cells. But in actuality, it's a good thing if they go through apoptosis for certain body parts. Morphogens are going to convey positional information. So a morphogen is going to send out positional information and promote developmental changes at the cellular level. And this is going to influence the fate of the cell. So it's going to tell those cells what they should be doing. Should they continue on growing and dividing? Should they go through apoptosis? It's concentration dependent. So a high concentration will restrict a cell into a particular developmental pathway. So if there's a lot of cells, they're going to be very specific as to what they should be doing. If there's a low concentration, that's going to give the cells more freedom to kind of do what they want. We talk about Drosophila a lot. We know those are fruit flies at this point. And you may wonder why we talk about fruit flies so much. I don't care about flies. We talk about them so much because they are very easy to study. They're very easy to get a hold of, and they mature very quickly. It's a lot easier to study a Drosophila than it is to study a human, for example, because you might be studying one human for 90 years. And then how old are you going to be at that point? Are you still even going to be living? We don't know. So after fertilization, back to the flies, the zygote's going to develop into a blastoderm. The cells are going to rearrange, producing a gastrula. The embryo is then going to develop into a larva. After 3 larval stages, it becomes a pupa, and it proceeds through metamorphosis, which produces a mature adult. It's a 10-day process. It's super fast. This is what it looks like here. We have our fertilized egg. We go through the nuclear cleavage and get the blastoderm. Then we get the gastrula. It's going to then enter its first larval stage. Second larval stage hits at about 4 days. Third larval stage is around 6. Metamorphosis, where it is starting to change, is at 8. And we get that adult fruit fly between 10 and 12 days. So phase 1, the embryonic pattern of development is established for the body axis prior to segmentation. And a bicoid gene is going to cause the embryo to develop a head and a butt end. Everyone has a bicoid gene, and it's super important because otherwise you would end up having 2 butts. Yes, you would have a butt where your head is. Nurse cells are going to supply the products of maternal effect genes towards the anterior end of the egg. And the bicoid gene can activate the genes in certain regions of the embryo. So the bicoid gene is highly concentrated at the anterior end. This is the butt end, and that is what is going to actually become the organism's rear end. These are all the segments. We know that the head's going to be up here because of that bicoid gene, and then you have your T1 to your T3, and then you start with these abdominal segments. Segmentation genes. You have a gap gene, which is several adjacent segments that are missing in the larva. The pair role gene is alternating segments are deleted, and segment polarity gene, there are portions of the segment are missing. So these are things that can potentially go wrong when the fly is developing. And this is what that would look like if you have a gap gene. So here's a normal one, and if it has a gap gene, this is what it would end up looking like. So it's missing every other one. No, it's missing a good bit of them, actually. For the pair rule gene, that's where you skip every other one. And for the segment polarity gene, it's missing random things there. Phase 2 segmentation is going to occur. So the maternal effect genes are going to activate the gap genes, which activate the pair rule genes, which regulate the segment polarity genes. Wow, that's a lot of regulating and activating. All these things are needed to properly form the fly. Each segment will then develop its own characteristics. Cell fate is going to describe the ultimate morphological features that a cell will adopt. And homeotic genes are going to regulate the development of anatomical structures. Phase 4, your stem cells are going to divide and differentiate into specialized cell types. Stem cells can divide and differentiate. And I have a couple of videos here that I'm going to show you real quick, and then we will finish up our notes.
It became very popular a few years back to call them cancer stem cells. But I think people have come to appreciate that there are long-term self-renewal cells in cancer that have some stem cell characteristics, whether they really come directly from a stem cell or whether they have redeveloped stem cell-like properties is really the current question and a focus for a lot of research. Long-term self-renewal cells in tumors are not normal. They have acquired the property of being immortal, and their relationships to normal stem cells is the focus of investigation. Certainly they have many properties thereof. They can even, in the most aggressive tumors, resemble embryonic stem cells in their gene expression patterns and some of their properties. But they are, by definition, abnormal cells. Well, there may be parallelisms within those tracks. Like I said, if a cell being induced to go backwards has to recapitulate its epigenetics in a reverse order, take all the steps that it got going forward to get there and now say, okay, go and reproduce those in the opposite direction. It would be naive to believe without studying it that every one of those steps would be performed correctly. And what cancer teaches us in a self-renewing system that's its risk for cancer is that if a cell is asked to divide more times than it usually would, to go from a most immature to a mature cell, you're giving time for errors, nuanced errors, but if they get imposed, can change the stripes of that cell, if you will, going forward. And so I think that we just need to ask those questions and stratify what actually is going on. But yes, I think there is the potential to make cancer-related mistakes going backwards. And then that means that that cell will expand in a way that has tumor risk properties. And that's what I think we need to monitor. And in turn, for us as cancer biologists, can we learn something about the mistakes we know cancer cells are making and allow us to manipulate those in a therapeutic way to have an anti-cancer strategy. So I see them going back and forth, learning from one another. We know cancer is a genetic disease. It's driven by mutations. But there are epigenetic changes in cancer. And it may be that some of the epigenetic changes that allow a cell to expand in an early or stem cell or progenitor state allows it to survive the mutations, then they work together. If the epigenetic terrain was taken out from underneath that mutation, that cell may not be able to tolerate the mutation as an oncogenic event. It may die or senesce, and this is the hope for reversing these epigenetic therapies. One of the things that we're working very hard to determine now, the drugs that do reverse the epigenetic changes that we have hopes for therapeutically, don't know if all their therapeutic effects will be purely epigenetic. But one major question is, do they work because they can block stem-like or progenitor-like cells and take them away from the population of cancer cells? And a lot of people believe that's become a holy grail. If you can take the long-term self-renewing cells away from the cancer, that's your best chance for long-term cure. And then you think about disease from an epigenetic standpoint, is how many steps along the way could you induce an abnormality? You say to those genes, wow, I just silenced you, and you ought to come on at the next step, but you don't. So that cell may remain immature. It may not take that step. And then if you get chronic inflammation around that cell, then you're going to expand a population of cells that doesn't quite know how to grow up, doesn't know where to go. So it keeps growing that way, and a mutation comes in, and now it really knows how to go somewhere in a sinister way. And that's kind of the way the dance goes.
So this next one is going to talk about stem cell therapies. And then I have one that's going to go in the opposite direction. This one's saying that they're negative. Another one is going to say that they're positive. I do both because I want you to hear both sides of it before you try to form any kind of an opinion, just so you know all the information that's out there.
Have you seen ads or attended a seminar for stem cell therapies that claim to be able to treat diseases like chronic joint pain, Alzheimer's, cancer, and more? Don't believe it. You may be told stem cells, including those from fat, amniotic fluid, or umbilical cord, like cord blood or Wharton's jelly, are a miracle treatment. You may even hear they're FDA approved. That is not true. None are proven to work to treat these conditions, and worse, some may cause harm. The FDA has not approved stem cell therapies for treating these serious conditions. The FDA has only approved a stem cell product for treating certain blood disorders. Beware, unapproved stem cell therapies have led to serious infections, blindness, and death. If you are considering a stem cell therapy in the U.S. or outside the U.S., ask questions. Visit fda.gov to find helpful information and questions to ask in the FDA's consumer update about stem cell therapies. Protect your health. Don't become the victim of dishonest and dangerous stem cell clinics.
Hello, I'm Tim Nelson. I'm the Director of the Regenerative Medicine Consult Service here at Mayo Clinic in the Transplant Center. Regenerative medicine is a strategic priority at Mayo Clinic. and we have started a regenerative medicine consult service housed in the Transplant Center, as the Transplant Center has renamed itself the Transplant Center and Center for Clinical Regeneration. One question we commonly get from patients and providers is, what is regenerative medicine and stem cells? The easiest way to understand regenerative medicine is it's the opposite of degenerative disease. As we age and our bodies get older, tissues break down and we lose function in our cells. Regenerative medicine is the idea of how to rebuild those tissues. And the science is teaching us today that virtually every tissue in our body is able to regenerate at some low level. And the better we can understand that and the more we can apply that to allow the body to heal from within, the more useful regenerative medicine will become to our patients. The other concept is stem cells. What are stem cells? There's many different types of stem cells, and all types of stem cells have different definitions and different functions. But the easiest way to understand what they do is sort of like gardening or planting seeds. If you plant a seed, you can grow a flower, a tree, a cornfield, and planting the different type of seeds grows different tissues. And the idea of regenerative medicine and stem cell biology is understanding which seeds we can plant into which part of the body to help regenerate and heal the body from within by growing new tissues. Regenerative medicine has been going on for a long time at Mayo Clinic in many places with hematopoietic stem cells or blood cancers. If needed, we use bone marrow transplantations to reconstitute and regenerate the red and white blood cells of the body after cancer treatment. But going beyond that, the science now allows us to look at tissues like the heart, liver, kidney, other solid organs, even the brain, to allow us to regenerate them. Understanding the science and understanding what's currently available and what may be in research settings is the purpose of the consult service. We try to connect and educate patients and providers so they can understand what the hope and what the hype is of stem cells and regenerative medicine today. And many patients that have questions about transplantation wonder, what about stem cells and would this be applicable to my condition? And our physicians and nurses that work in the consult service are here to help educate and train providers across the country of what is available today in the clinic and what may be available in research settings to engage patients as we try to do new research and invent the new therapies of tomorrow. One example of a patient that has seen us in the consult service called us because they had a congenital heart disease that their heart wasn't functioning properly. Even though we are working on protocols in the research setting to make this technology available to our patients, it currently was not available to this patient. But because they contacted us and connected with us, we were able to educate and provide that information. But more importantly, we were able to connect them to the clinicians and surgeons that did have therapies that could be offered for her condition today. And she was able to come and have these therapies here at Mayo Clinic. And this is an example of how the ideas of regenerative medicine may not be real today for everybody, but may allow us to connect with other providers that have real options today. And the hope is that tomorrow we'll continue to have new therapies with stem cells that we can add to our repertoire of therapeutic options.
All right. So that just gives you a little bit of insight into what, different people feel or how they feel about stem cells and all of that. So here are the different types of stem cells. And later on in the week, you guys are going to do a little activity where you're going to be determining what type of stem cell would be best to treat different types of disorders or diseases. So we have the totipotent, which is a fertilized egg, which can give rise to an entire organism. Embryonic stem cells are the ones that you most commonly hear about. They can differentiate into almost every cell, but they cannot produce an entire organism. And embryonic germ cells, they are just the sperm and the egg cells. Multipotent, they can differentiate into several types of cells, but far fewer than the ES cells. And unipotent, these are cells that can only differentiate into one cell type. Potential uses of stem cells, we may be able to cure these different conditions by utilizing the different types of stem cells that we know of so far. The big controversy with stem cells are the ethical issues regarding how they are obtained. they always say, oh my gosh, they're taken from aborted babies. And I can't confirm or deny what goes on with that whole process, but I do know that there are other ways to obtain stem cells. It's not just from abortion. For example, if a woman has a child, they have to pull the placenta out, otherwise it couldn't kill her from bleeding out. And if the woman doesn't want that placenta, which you can take them, you can dry them out, grind it down, eat them. Animals eat them all the time, so I guess there are some benefits to that. Supposedly, it'll put nutrients back into your body that you may have lost. That's also a controversial topic on its own, but there are some stem cells within that placenta. So if the woman isn't using it, maybe you could take them from that, and that has nothing to do with an abortion or hurting anything at all. They're just going to be thrown away anyways. There are also different government regulations regarding, how they are obtained, and stem cells could treat many diseases. And you'd think, well, why is that a controversial issue? If they could treat something, why wouldn't we use it? And that all goes back to how we obtain them. Some people just, I guess they'd rather, let things play out, and you want to have those big pharmaceutical companies, which would probably go under if you're starting to treat different diseases with these stem cells. If you're curing something and they're only treating it, well, then they're going to be having issues with money on their own. So there's a lot of things that go into, can we use stem cells or not? All right, let's talk about development in plants. Most growth is going to occur through cell division at the tips of the shoots and at the bottoms of the roots. The middle section of the plant isn't actually going to really grow at all. Meristems are organized groups of actively dividing stem cells, and meristems are going to produce offshoots of proliferating and differentiating cells. The root meristem is going to produce only the root. The shoot meristem is going to produce all the aerial parts, so anything that's above ground of the plant. The apical region is going to produce leaves and flowers. The central region will create the stem, and the basal region will produce the roots. And that is it as far as plants are concerned. All right, well, that's all for today. And I will see you guys soon.